Good morning. My name's Maurice Crespi. I'm the managing partner of Schindler's Attorneys. Schindler's Attorneys, together with Engaged Business Turnaround and IQ Business, are co-founders of COBRA. COBRA is South Africa's largest pro bono corporate initiative. What's involved in COBRA is a knowledge base on our website. We have pro bono Zoom sessions with you and your staff. We answer questions in relation to specific issues you may have or industry related. And part and parcel of the pro bono service is the hosting of these webinars. We have these webinars on a daily basis, sometimes 2 per day. And the webinars are advertised on the COBRA website, www.cobra.org.za. So please look out for those. Today we have a very exciting webinar. We're joined today by Martin Kingston. To introduce Martin Kingston, he's had some 40 years experience in the financial services industry, initially as a chartered accountant and tax specialist, and for the majority of his career as an investment banker, focusing on a wide variety of disciplines based in the United Kingdom and South Africa, but traveling extensively internationally and advising entrepreneurs, corporates, governments, and state-owned enterprises around the world on major transactions, capital raisings, and strategic initiatives across a wide variety of sectors. He's also intermediated extensively between government and the public sector and the private sector, and we'll be hearing quite a bit about that today. Martin has been involved in a significant number of mergers, acquisitions, and disposals, unbundlings and listings, major structuring and financing of projects, privatization and restructurings, bond issues, and equity and debt capital raisings, as well as the direct provision of finance. His clients have included government, state-owned enterprises, major corporation institutions. So Martin is joined today. The discussion is going to be unlocking the lockdown level 3 and how it affects us. Obviously, we're going to be focusing on how it affects us from an economic perspective. We'll be discussing what the outlook is, and in the short term and in the long term. We're also joined by Adam Craker, who's also going to be joining us in the discussion. Adam is the CEO of IQ Business Group. He has been the CEO for almost 10 years now. He's been a big driver of this initiative. And Ian Flemming, who, as I mentioned earlier, is the CEO of Engaged Business Turnaround. So thank you all today. I'm going to kick off, obviously, with you, Martin. Martin, you've been an advocate. You've been advocating the uplifting of the lockdown as quickly as possible. Can you possibly take the audience through your thinking in that regard?
Yes, of course, and thank you very much, Maurice, for inviting me. Nice to see Adam as well on the panel. And good morning to everybody who's listening today. Business for South Africa came into being about 12 weeks ago. It was as a result of a special NEDLAC executive committee called by government. I was leading the Business Unity South Africa delegation to NEDLAC, and we agreed that we needed to put in place a set of special arrangements to deal with the advent of COVID-19 at the very beginning of March. I suppose it would be fair to say that we assembled or mobilized resources, recognizing we didn't want to just use conventional business structures, but we wanted to put in place an all-embracing capability in the form of Business for South Africa. Business for South Africa is a virtual organization sponsored initially by Business Unity South Africa and the Black Business Council, but anybody and everybody who has a role to play and a contribution to make is invited to participate on that platform. I think we've got about 450 people working pretty much full-time on that platform, pro bono. They put their personal and their institutional identities aside. The brand is Business for South Africa, and we've been engaging both with business as well as with government and more broadly with society over the past 10 or so weeks. And one of the issues that we've talked about extensively, Maurice, which which I think would be of relevance to many of the people who are listening here, is indeed the lockdown, as you've said. We advocated directly to the president a lockdown when he was consulting with business and other social partners. Our arguments for that have been well rehearsed by everybody, but it was basically to ensure that we could establish and reinforce the first line of defense in terms of our health defenses. We didn't at that time have any PPE of any significance in the country. We now have some, not enough, but certainly we have some, and we're beginning to ramp up our own domestic manufacturing capability. We didn't have hospitals, either existing or field hospitals, that were prepared. And in fact, we didn't make sure that the front line of defense in terms of the healthcare workers, everything from the specialists, I have to say, to the morticians, were able to do what was required. So the consequence of that was the lockdown that we've seen. We didn't want it to extend for as long as it did extend. The truth is that I think government was very uncomfortable about releasing the lockdown from level 5 through other stages until the country was in a state of readiness in respect of its health defenses. There were two issues that we emphasized. One was the ramifications for the economy. I think that's been very clear. And unfortunately, the consequences have already been devastating. Very significant levels of unemployment that have emerged, contributing to already unprecedentedly high levels of both narrow and broad unemployment. Significant numbers of businesses, small and medium-sized businesses, as well as larger businesses that have gone to the wall, and inadequate levels of support from government, we can talk about that, to be able to provide the necessary safety net. So we emphasized that to government. We did very extensive modeling, both healthcare and economic modeling. We've got an integrated model, both nationally, provincially, as well as locally, in terms of modeling by sector and indeed by location, what the ramifications are likely to be. And what we advocated, and I think we've been quite public about this, has been the need to transition through levels 4 to 3 and then to 2 as quickly as possible. In fact, those of you who have read the regulations will see that what we have characterized as level 3 is in fact what I'd call level 2 minus. It's better than the original level 2 regulations. In fact, the entirety of the economy has been opened up with caveats. Obviously, those caveats, the biggest one, of course, is tobacco. There are certain other sectors of the economy, including personal care, such as hairdressers, tattoo parlors, nail salons, beauty treatment, and so on and so forth, which we're currently working on with the Department of Small Business Development and the industry to try and see how we can deal with that. But with those exceptions, restaurants, obviously, to sit in restaurants, but tobacco being the most significant one. The rest of the economy is open for business, and we've got to try and ramp it up as quickly, but as responsibly as possible, recognizing that at all times we need to ensure that we observe the necessary health and safety protocols. It's easy to say and difficult to do. Obviously, we've put in place workplace protocols across many sectors of the economy. They have to be specifically adjusted to the industry concerned. So hairdressing has a very different type of protocol to the fast food industry, for example. But that's one area that we think we can cover off on relatively well. The second area we have to worry about, if I may, is the area of public transport. It's a very significant vector for transmission. And I think we all know, everybody on this call, that we're not going to avoid the virus. We can just slow the volatility, if you like, and pace of transmission and associated illness, infection, and of course death. But we can't prevent it. And sort of informed thinking at the moment is we're probably going to be with it until at least the end of next year, by which time hopefully a vaccine will be available, but even on a global basis, that's an ambitious target. And the third, of course, is in the communities where we live, which is community transmission, which is likely to be the most significant form and vector for transmission. That's what we've seen taken off in a number of situations. And there we need to really instill behavior change in everybody in terms of social distancing, in terms of hand sanitation, wearing masks, other forms of PPE. I think that's going to be a very major campaign, and everybody on this call has a role to play, not just with respect to themselves, but with respect to everybody around them. At the end of the day, we are putting others at risk if we don't act responsibly. And finally, the last point I think I would make, Maurice, is that we've seen the emergence of very significant societal stresses and strains. It was bound to happen. It's been exacerbated by increasing levels of infection and death, by the schools potentially going back this week, by many unanswered questions still being in existence, and indeed by reinforcing and magnifying the very issues as a country we've been trying to deal with over the past 25 years of poverty, unemployment and inequality, all of which have been exacerbated by COVID-19. I'm sure I've said more than enough, but just to set the scene as to where we are and how we're moving forwards.
Thanks so much, Martin. Please, audience, ask questions, and if the panelists have anything to say, please jump in. The idea is that we do engage. This is a webinar, so we really ask that you provide us with questions. Martin, you said that you have had meetings with the Department of Small Business Development. What's government saying in relation to the lockdown industries such as tobacco?
So tobacco is very different to the Department of Small Business Development, although it will be of interest to you and I'm sure many of your participants today, that there are nearly 250,000 people who are employed in the tobacco industry, including individual hawkers and traders, who at the moment don't have a livelihood, or to the extent they do, they have to rely upon selling illegal contraband tobacco. I don't know how many of you know, but 40% of the trade conventionally is contraband. It's now 100% of the trade. Before we went into lockdown, there were 11 million people who smoked. I suspect that there are still 11 million people who smoke in the country. They just don't smoke legal tobacco. We have pressed government very hard for a rational motivation for the industry to be closed. We don't think you can close it at level 5 and 4 and 3 and then open it up again at level 2. There's no good rational reason for that. By the way, I'm not advocating tobacco from a health perspective at all. I'm simply saying there needs to be logic and rationale and transparency that underpins these decisions. As you know, BAT and other members of the industry have now gone to court over and above those. It was the fair trade movement that had originally gone to court. BAT's now gone to court. And I suspect that there will have to be an accommodation. There's nothing that prevents government from changing regulations in midstream. And in fact, that's what we did with the need for e-commerce. When level 4 regulations came out, e-commerce was not permitted. We had many engagements with government at ministerial, departmental levels across a number of departments. And we motivated that all of e-commerce needed to be opened up. It took us about 10 days of negotiations, but the truth of the matter is that they opened up all of e-commerce. I'd like to think that the same will happen with respect to other sectors of the economy that are perceived to be high risk, which includes, of course, as I said, the sort of beauty treatment, hairdressing areas. They're perceived to be high risk in terms of transmission, but we're working on them. I was speaking to the person who's leading our team in the engagements with both the industry and the department. I was in contact with the Minister of Small Business Development earlier this morning. I think we'll make progress in the next few days. I don't think anybody in government wants to limit the economic activity that we need to encourage, but they are understandably concerned about transmission rates. And we haven't even started going up the curve, really, by the way. What we're seeing in the Western Cape is extremely worrying. But if you anticipate that the modeling, and it's just modeling, sees between 40 and 48,000 people losing their lives to COVID-19 in the next few months. That's a very sobering reflection of just how challenging the situation is. So we need to be responsible about how we deal with it. And if it takes us a few more days, although we understand that jobs and therefore livelihoods are at risk, I would rather advocate that we're cautious about persuading government that regulation is the right thing to do, because nobody wants to have the responsibility of deaths or sickness on their hands. I mean, that's what we've seen, not just in South Africa, but around the world, Maurice.
Yeah, it's interesting. Sorry, Adam, you wanted to say something?
I just wanted to come in, if I may, Maurice. Firstly, Martin, it's great that you could join us this morning. I'm sure you saw yesterday that the Treasury updated their forecasts in terms of potential job losses to around 1.8 million job losses. We've heard some pretty wild numbers ranging between 3 to 7 million. And obviously with the progression and forecasts in terms of gradual relaxation of lockdown, those numbers, even at 1.8 million, are extremely high. I think in the region of about twice the level that we experienced in the global financial crisis. Do you have a view at this stage of what we're heading towards in terms of economic contraction for 2020? And secondly, you were the first person that I heard mention the prospect of a potential economic depression. I'd love to hear your view now at this point, what you think the prospect is for that as well.
Yeah, thanks a lot, Adam. So let me start on the depression. I was very selective and deliberately so about my language. The fundamental difference between a recession and a depression is the depth and the duration, as we know, of contraction. Now, we see, in terms of the modeling that we've done, and our model is the same as the National Treasury model. I mean, we're not using exactly the same model, but it's the same methodology that's used. It's a bottom-up methodology, sector by sector, location by location. Nearly 50 sectors of the economy and subsectors that we've modeled. It's a PwC model, very, very comprehensive. I'm happy to share some of the outputs with you if that's helpful to share with the people on this call. That showed, depending upon how quickly we migrated through the levels, that in a worst case scenario, we were talking about a contraction for 2020 of between 10 and 15 or 16% contraction in GDP, continuing through 2021, and that it would take between 3 and 5 years to return to the level of economic activity that we left behind in at the end, if you like, of 2019, beginning of 2020, where we were already, by the way, in a recession. We'd had 2 quarters of negative growth. Whether we want to talk about a technical recession or not, we were in a recession. Now, when we move from flat lining to -10, -15% contraction, that is a depression. That is for sure. The accompanying figures that we had in terms of unemployment was up to 2 million formal and 2.9 million informal jobs being lost. National Treasury, in the documentation that they submitted to Parliament about 4 weeks ago, said in their worst case scenario, 7 million jobs being lost. That takes narrow unemployment, not broad unemployment, narrow unemployment, which is already over 30%, to 50% of the working population. I mean, that's an Armageddon scenario for South Africa. We don't have the financial wherewithal or the fiscal space to provide the social relief that is required for those people who have lost their livelihoods and need to rely upon social support. And I think we need to talk about that as a country, because in reality, we are losing potentially a year of education if we don't get it right. We've all seen what is happening at the moment. It's very challenging. We are going to massively exacerbate the level of youth unemployment. We're going to have to think about something much more creative and much more aggressive than we've dealt with in the past. So we were much more negative than consensus in terms of forecasts. if you actually look at what has happened, consensus has moved radically towards where we were. We said that the difference between moving to level 2 quickly and gradually moving out of level 4 lockdown could be up to 6% contraction. In other words, the difference between 10.5% and 16% or so in the context of GDP contraction, and that we could shave about 4.5% off the fiscal deficit, again, if we moved as quickly as possible. Now, by the way, we just need to be cautious. There is the possibility that we can return to higher levels of lockdown. We think that's not practical or possible. Just as we said that we didn't think it was implementable to have differing lockdown levels in different geographies. We agree with the hotspot mentality, but that's not a different level at the moment. We just don't think that people or indeed businesses can operate in a functional manner as a consequence of that. But it is fair to say that it is not just an endogenous sort of domestic issue, it's exogenous as well. We have to look at the fact that our investment and trading partners themselves are now in extremely dire straits, depending upon the countries that we're talking about. I am most concerned not about the rest of the world and South Africa. I'm actually most concerned about the rest of the continent, which doesn't have the social or the healthcare infrastructure, let alone the economic wherewithal, to do even a fraction of what we're doing. And what we're doing is woefully inadequate relative to the requirements. When I say woefully inadequate, it's not that we're not throwing all our resources at it. We need to recognize we've got limited resources. When we talk about the US, it's putting $3 to $4 trillion of stimulus, behind COVID-19. The 500 billion that we've announced, although we could debate whether it's 500 billion or more, is actually not a stimulus package. It's a sort of rescue package for humanitarian reasons, both in terms of vulnerable households or people and businesses, small and medium-sized businesses. It is not the stimulus that we need to put in place if we're going to recover as quickly as possible from the depression that you asked me about, Adam.
I'll just jump in there. We do have questions which I'll get to, but I have a question. Now, you're not advocating a dynamic lockdown, but what are you saying ought to happen if the healthcare system just cannot cope? So in other words, if it breaks the curve and we're in trouble, surely at that point, government ought to consider a second lockdown.
Yeah, so the lockdown only serves one purpose, in truth. I might argue it serves two, which is it enabled us to get our sort of broader house in order and to apply our minds. But in truth, it is to prepare the healthcare system as best as we can. Preparing the healthcare system has really 3 or 4 primary elements associated with it. One is ensuring that we've got the right infrastructural facilities in place, either existing hospitals and or field hospitals and the like. The second is ensuring that we've mobilized as much healthcare support in terms of healthcare workers. And as I said, that's everything from specialists to morticians. We might not think of them as healthcare workers, but they are healthcare workers. They're in the front line, I'm afraid, right in the front line. Either those that exist or those that have retired, mobilizing them to the best of our capability. And the third is ensuring that we have PPE available, not only just for our healthcare system, but for the country at large. You can't go to the dentist if the dentist doesn't have PPE. Many people who have comorbidities, pre-existing conditions, don't or can't go to hospitals or to doctors now because of the risks that are being run as a consequence. But I think we all know that means that they are now running risks from pre-existing conditions. Okay, so we needed to buy time to be able to not so much flatten the curve, but push the curve. That's what we've done. We've delayed the advent of COVID-19. When it arrives, there is no doubt that the healthcare system in different aspects may become overwhelmed. We hope that it won't, but it may become overwhelmed. Returning to lockdown will no longer be able to deal with that issue because I think it is widely anticipated that the transmission rate is going to accelerate as a consequence of moving to level 3, and through level 3 to level 2, and through level 2 to level 1. In other words, some form of new normal, because it's not a normalization, some form of new normal for the economy. Now, unfortunately, the only way that we can reduce the speed of transmission is in behavioral change, as I said. And anybody who watches their TV will see that behavioral change is not being observed. By the way, it's not just not being observed in South Africa, it's not being observed in the UK, it's not being observed in the US. So if you speak to the experts, and I'm sure many of you do or watch them, they say that's simply going to encourage another surge. That's going to be the consequence. And until such time as we either have an antidote, which we're not going to have, we don't have an antidote to the common cold, by the way, or we have a vaccine. We don't have a vaccine for the common cold either. Or we have herd immunity, and herd immunity is 60 to 70% of the population. That's going to take us, an extended period of time. What we need to do is ensure that we conduct ourselves as responsibly as possible in the interim. Returning to level 4 or 5, I believe, and Business for South Africa believes, is a step we actually cannot afford to take, because we simply exacerbate broader risks for society, including healthcare risks, by the way, because we're going to start seeing people with comorbidities dying and becoming much sicker. We're going to see much higher levels of malnutrition. We're going to see significant increases, as we've already seen, in the levels of gender-based violence and so on and so forth. As a society, we just cannot afford that. And if you've listened carefully to the president, one of his concerns is exactly that. One of his concerns is that society is going to become under enormous stresses and strains, and we need to alleviate that as much as possible. And when you look at a lockdown and the operability, if I can put it that way, of a lockdown in a township or an informal settlement set of circumstances, it's almost impossible to see how that can practically be observed.
Let's move to questions from the attendees. We'll start with Elton Grieve from the Western Cape. Thank you very much, Elton. Can we still trust what government says when there's talk about utilizing the COVID-19 lockdown / pandemic to restructure the economy? What does this mean for business and the economy in general?
Yeah, let me answer that specifically. So we don't believe that COVID-19 should be used as an opportunity to push through policy change for its own sake. We don't think that's the right forum or opportunity. Tobacco is a good example. We can agree that tobacco is bad for one's health. I don't think there's anybody who would maintain it's good for us. It might be good for one's stress levels, but it's not good for one's health, that's for sure. And so if there's going to be a discussion about banning tobacco, then that needs to take place in a normalized set of circumstances, not in COVID-19. We can understand the economic ramifications of trying to control tobacco. We're having a conversation at the moment with the government about localization. I think localization is a useful discussion to have in a set of circumstances when, frankly, we can't import many of the goods that we would ordinarily import. That seems to me to be a sensible discussion to have. But there's a broader conversation that we're now starting. We've been very public about it, as has the president, which is the need to fundamentally restructure our economy off the back of COVID-19, not during COVID-19, in a post-COVID-19 environment. So let's call it AC, after COVID-19. What should the economy look like? And we know that it needs to be inclusive and sustainable and have a much steeper trajectory in terms of economic growth than anything that we've experienced over the past 10, 12, 15 years. So we as Business for South Africa are working on that currently. We intend to finalize our work in the next 2 weeks. We will then share it with government with the intention of seeking to find common cause as to how we can address many of the obstacles and constraints that have confronted the economy in the past. I don't think any of them would come as a particular surprise, by the way. Whether it's releasing additional spectrum or dealing with the visa regime or the small tape or the significant amount of red tape for small businesses. we have been repeatedly advocating for these things to change, and there's been a lethargy or a reluctance or an inability on the part of government to deal with that. My own sense is that if there is a silver lining, this is the silver lining in the COVID-19 cloud, is an acknowledgement that we need to make fundamental changes in terms of how we construct and run the economy. And we should be having that conversation now, but as I said, implementing it realistically over the coming months and the year. But we shouldn't be using COVID-19 as a sort of a Trojan horse, which I think is what sort of underlay the question, to push through policy that is sort of inappropriate or that we don't support.
We have another question by an anonymous attendee. I read yesterday that scientists advising government advised moving straight into level 1, but that government elected for a cautious middle ground approach, meaning that level 3, meaning level 3. Have we already passed the point where the harms of lockdown will do more harm to society than what the numbers suggest COVID would ever could?
Yeah, I'm not sure that may be so. I'm not sure it's a constructive conversation, by the way. I mean, we are where we are. My own view is we are not in level 3. We can call it level 3 because the government came out with a 5-level plan. But if you pull out the regulations that were published, we are at somewhere between level 2 and level 1. I think that that's where we needed to be. That's what we advocated for in our engagements behind closed doors with government. We were led to believe that that might be one of the outcomes. I think that, as I said, bar the exceptions that we've already identified, which is tobacco and sort of the healthcare industry, and obviously the gaming and casino industry. There are 4 or 5, examples that we can talk about. And by the way, they want to open those up as quickly as is practically possible. The tourism industry has suffered almost a death blow as a consequence of what is happening, certainly in the short term. The support that's available, 200 million rand, if I remember correctly, is far from adequate to alleviate, what is going to happen to people who are, players in that industry, large and indeed small. We need to move as quickly as possible. My concern, by the way, is that all social partners come to the table, because if we start having problems with organized labor, then we're going to have a very major barrier that as a country we're going to construct for ourselves. Our conversations with Labour in the NEDLAC chamber have actually been extremely constructive, collegiate, collaborative. But, the proof of the pudding is going to be in the eating when we all go back to work, when there are no pay rises for anybody. In fact, we're advocating pay cuts, not pay rises, including for senior executives. It's inconceivable that we're going to be able to see the same sort of disparity in pay, which doesn't mean we're going to bring up pay. It means we're going to reduce pay. We're going to reduce compensation. Look at what's happening in the financial services sector globally. They're regulating to exclude bonuses in the financial services sector in many countries around the world at the moment. I think that's going to become a theme we're going to have to, talk about and deal with. Dividends. I think there's going to be an issue about dividends in the immediate short term, the next 1 or 2 years. That's going to have ramifications for pensioners, who rely upon dividends to support their income in retirement. I think there's some very tough conversations as a society that we are going to have. And in that respect, I'd like to make sort of a plea, because I know we've got many people on the phone or listening in. Business for South Africa is a bit like COBRA. It's a voluntary organization. We need subject matter experts in a whole range of disciplines. I have no doubt that there are many who are on the phone working from home, or maybe not working at all, sadly, who can give of their time, who've got expertise, which we can use, because Business for South Africa is a project. We don't see it having a long-term life, but it's going to be a project that exists until such time as COVID-19 has been sort of assimilated, if you like, into our normal way of life, and more appropriate business formations or associations can take over. They didn't exist for the purpose of the interventions on COVID-19, and we would like to make an appeal, to all of you, that if you've got skills and capabilities, either as institutions, that you've got teams of people who might be available for, 4 weeks, 6 weeks, 8 weeks, for much of the time, we can use them. That is for sure, across a range, as I said, of disciplines. We've got 130 lawyers that are sitting on the platform giving specialist input, depending upon the circumstances. We've got 25 communications experts, both for internal and external communications. We've got a panel of risk advisors, chief risk officers from across sectors of the economy, not just to advise business, but to advise at a societal level what the risks are that we are running. We called out very early on in the equation, the biggest risk was societal stress. That was the biggest risk. And indeed a breakdown in law and order. Exactly what we're seeing in the United States, we called out about 7 or 8 weeks ago. So there are many disciplines that we are looking for where we would appreciate the support that I'm sure COBRA and its members can provide.
I think that's exactly it. So we'll answer the plea before you jump in, Adam. COBRA has in excess of 1,000 professionals, and we make them all available, obviously, to yourselves. That's the idea. Yeah, you were going to say something, Adam?
I was going to say that really strikes a chord. I know it will do with you, Maurice and Ian, and the 43 partner organisations that have come into COBRA over the last 2 months. One of the perspectives that was shared with me by Gordon Little, the CEO of FNB Commercial Bank, a couple of weeks ago, was that he really feels that we are going to be swamped as an initiative, whether COBRA or Business for South Africa, or for that matter, he was describing the economic tsunami that is building with the expectation that the banks are going to be able to be that front line of defence and lending mechanism and support for businesses. Would you agree that at this particular moment that we're actually in the eye of the storm, which is a very surreal point at this stage, with yesterday massive queues of South Africans outside of bottle stores and various outlets to go and replenish their alcohol stocks. But do you think that we're in this kind of euphoric moment of a situation that actually the hurricane is upon us and is going to wreak havoc on the economy at this point?
Yeah, so let me answer that question in a couple of ways, including one that I see Gareth Ackerman has posted to the site, which is,
can I just jump in and read Gareth's question for Facebook viewers? Martin, the concern being expressed is that government is very focused on the saving of lives, but not sufficient focus on how they will fund their initiatives. Whilst much has changed over the past few days, poor leadership is still prevalent on how this will further play out. How do you see the economy turning, particularly as the government initiatives around job creation have been shelved?
Okay, so I think it is partly associated with the question that, Adam, you were just asking, and I'll answer that as well if I may. So for me, what COVID-19 has demonstrated so far, and I don't think we're in the eye of the storm. I really don't. I think that the storm has just about made landfall. But when we start seeing several hundreds of people dying every day, which is what I am bracing myself to expect, not 30 or 40 people, and each life is as important as the next. But in terms of numbers, we're going to see a very significant acceleration over the coming weeks and months, particularly as we move into winter. I think we all intuitively know that, even if we don't want to admit it, if I can put it that way. What it has demonstrated is the incapacity of the state. It has crystallized at first hand what the president has now repeatedly called out, which is we do not have a competent and capable state. I'm not putting words in his mouth. Those words have come out of his mouth repeatedly. It's his number one priority. And now we have a situation where we can't run business as usual. We can't deal with COVID either. Now, in certain areas, I think that the government has been responsive. But if we are going to avert an economic meltdown, I haven't used that word before, but that's effectively what we're talking about when we talk about, an additional 10, 15% narrow unemployment being added to over 33%. When we talk about borrowing costs going through the roof for the country as a sovereign, when we talk about the fact that there are many sectors of the economy that don't have the financial wherewithal to restart, they will have stalled. How do you restart them? One of my biggest concerns, and Adam, you have mentioned this is sort of a question that I've got for this group in a way, is I've seen no intelligent analysis, which doesn't mean it doesn't exist, maybe I just haven't read it, as to an increasing level of businesses going into insolvency, whether it's business rescue or liquidation, and whether as a country we even have enough liquidators and business rescue practitioners, by the way, and whether or not the regulations are fit for purpose for what is about to happen or is already happening. I mean, as a former director of SAA, I watch with horror, I have to say, shock and horror, what is going on with respect to SAA. I'm glad I'm not on the board anymore, so I don't need to speak about it, and I can keep my trap shut because I'm conflicted. But that's just a very high-profile example of what is happening all over the economy. We know that banks are receiving not multiples, but 10, 20, 50 times the level of defaults that they have been used to historically, considerably worse than at the peak of the financial crisis, by the way. And the banking sector, although we know they're adequately capitalized, and I'm comfortable about that, we've had conversations with the Reserve Bank, with the regulator, with National Treasury, and with the chief executive of the banks to assure ourselves that they are adequately capitalized. We're not going to see necessarily a bank that's going to go to the wall. Are they going to provide the requisite liquidity to business, which is what is going to be an absolute prerequisite for survival? Because we're not just talking about breaches of covenants, which is happening every single day of the week now. We're talking about the injection of significant incremental liquidity. And the sorts of numbers that are being talked about by government, 200 million here and 500 million there, even the 200 billion that is part of the 500 billion package, which is for companies with a turnover of less than 300 million, who will be familiar with that, I don't think it's adequate. I don't think the systems are in place. That, for me, actually, is, alongside the capacity of the state, the two biggest single concerns that I have right now in terms of the economic sustainability of South Africa and how quickly we can stabilize. Because the truth is that, we haven't even started to stabilize. The stabilization, in my view, is only going to happen maybe, if we're lucky, towards the end of this year, the beginning of next year. And then we're going to have to start a rebuild process. The government calls it, National Treasury calls it a pivot, how we pivot. But we're talking the same language effectively. So we've got to get through the next 6 to 9 months, I would say, stabilize, and then rebuild. And we've got to make sure we've got enough resources to be able to do that. Now, in that context, there is no doubt that the business community, including the many people who are on this call, have got a very significant role to play, not just to protect themselves, but to support and assist others, who need the skills and capabilities and resources that we have. I'm not saying we have them in abundance, but we have a surplus of those skills that are going to have to be shared, and they're going to have to be shared with other businesses, with civil society or society at large, and with government. That's the conversation that we're having with government at the moment, which is, when we talk about a mixed economy, we're not just talking about the ownership of that economy. We're talking about how that economy effectively functions, and it is going to have to harness the best resources that are available if it's going to survive and then start to rebuild.
Just to answer your question on business rescues, it's actually proven to be quite interesting because COBRA offers business rescue assistance, and we assist companies in going into business rescue. But what we found, Martin, is that creditors are cooperating and they're coming into COBRA And all one needs to do is mediate an arrangement, a payment arrangement between the debtor or creditor. And what we do in turn is get their creditors to jump into COBRA. So there certainly has been an uptick, but also a huge uptick in benevolence. We've honestly seen everybody cooperating with everybody else, and the actual act of having to put a company into business rescue has been rare. I have a question from Boshoff Krobler. A central government initiated lockdown level 5 seems to have been necessary for swift and effective action. Would you say that there are benefits to decentralize progressive unlock of the economy, giving provincial governments more responsibility for their regions?
I believe that's a very good question. In a world where there was competence in abundance, the answer to that absolutely must be yes, provided that there is a properly integrated and aligned approach. But I believe we know that if we have reservations about the depth and breadth of competence and capability in central government, it is only that much worse at most provincial government and local government levels. So, of course, in the final analysis, the front line is actually at local level. Implementation depends upon having local competence, but in the current set of circumstances, no, I don't support that. We've seen, for example, in the Department of Health, National Department of Health, and one of our 3 principal platforms, we have 3, as I'm sure you know. One is the Economic Intervention Group, which I also chair, as well as the Steering Committee for Business of South Africa. The second is the Labour Market Group. That's the one that's negotiating issues such as UIF, TERS, and COIDA at NEDLAC all the time, the return to work protocols, and so on and so forth. And the third is the healthcare, the public healthcare group. Some of these groups, public healthcare has about 9 or 10 different work streams, 100 people on the group. One part of that group is looking, for example, at issues of PPE and how we can procure PPE. So there's a portal that's open. About 6,000 companies have applied for the portal to be able to supply PPE. Now, I just want to give you a specific example there. We had hoped that the procurement of PPE could be a national competency. It's actually a provincial competency because we thought that would be more efficient. For political reasons, it's reversed to being a provincial competency. Our concern about that is that it encourages and enables corruption and maladministration to thrive when we can afford no frictional costs. We need to minimize the cost and maximize the efficiency of bringing PPE to where it's needed most significantly, both in the public and the private sector, by the way. You can't actually implement a lockdown without associated measures. Those associated measures, which have to be done at a local and provincial level, are, as you'll all be familiar, I'm sure, screening and testing and tracking and tracing. Okay? One goes hand in glove with the others. If you look at any of the models, Singaporean, South Korea, so on and so forth, it is lockdown, limiting the movement of people. That's all lockdown is. Lockdown is just an extreme form of social distancing. Lockdown, then screening. By the way, even on screening, there's a debate about how effective it is. Testing, as you know, we are way behind on testing. In some provinces, like the Eastern Cape, we're sort of 3 weeks behind. By the way, there's no point in testing somebody 3 weeks behind because by that time, it's all too late. You can't even follow up. And we don't have tracking and tracing that we've launched. Business for South Africa had a model to launch nearly 8 weeks ago, which didn't get launched for a variety of, I would characterize them as political reasons rather than anything else. The truth of the matter is that we need to empower the provinces, local authorities with the ability to do that because it's done at local authority level, not even at provincial level. Again, my plea would be we need to find smart ways in which the private sector can work alongside the public sector to bolster those resources and capabilities, because that's the only way that we're going to be able to find an effective manner of traversing the next, let's call it the next 18 months. I think that that's a good time frame for us to get our minds around. The next 18 months. Do I think that the borders are going to be closed for the next 18 months? No, I don't. Are we going to have flare-ups and, spikes or peaks or surges in the next 18 months? Undoubtedly. We're going to have to find a rhythm as a country for, economic stabilization and then growth long before 18 months. I think that's the work we have to do in the next, as I said, 3 to 6 months for implementation immediately thereafter.
Thanks. The next question by Nkululeko Zondo. Thank you, Martin, Adam and Ian, for the great insights. Only a pleasure. Questions: what is the fundamental 3 things that SA must do to rebound the economy, restore lost jobs and grow the GDP? This is looking into long-term solutions. Thanks.
Okay. So I think I've mentioned some of that, and I don't want to repeat myself, but if I had only 3 things that I would identify, I think the first is that there are some easy and quick wins we need to put in place immediately. So I've talked about them, like spectrum allocation, like dealing with visas, like dealing with the energy sector in terms of expanding the IPP program. They're all long-standing. It's easy to do. The regulations are basically on the stocks. I say that because we need to repair our education sector urgently, and we haven't even started, as we know. That is going to require a transition from conventional ways of learning to distance learning and to e-learning, particularly to e-learning. I think we all know that that was coming. It's been accelerated probably by a generation. In the course of this year, it will have been will leapfrog. We know that. We need to put our shoulder to that particular wheel, because it's our children that are going to suffer if we can't ensure that we can equip the education system with the wherewithal, and households, I have to say, with the wherewithal. So that's all about e-learning and data and 4IR. So it's one of our key themes that we're focusing on. That would be a second. And I think the third is that we need to cast aside, if you like, ideological sort of convictions that there's only one way of doing anything, because there's not. So a mixed economy is going to have to be critical. We're going to have to recognize that the state doesn't need to be the custodian of a whole host of assets. Doesn't mean it shouldn't be a smart regulator. It should be a smart regulator. But, a mixed model of ownership. And even if you read the paper that has come out in the last 3 days from the ANC, there's much of it that I think is, sensible, progressive, in line with our thinking. There are other things that we would disagree with. We need to ensure that we reinforce broken institutions of the state. That's not state-owned enterprises. I've talked about that already. Because at the end of the day, we place enormous reliance for society as a whole, on a functioning state. At the moment, we don't have one, and that includes at local and provincial level, not just at national level, which I've mentioned previously. So, as I said, none of these, nobody's going to think out of the box and work out a solution that we haven't identified before. What we need to have now is the political conviction on all sides. Political doesn't just mean by the politicians, on all sides, to move ahead in a sort of smart, inclusive, and sort of a comprehensive manner.
Martin, I just want to check, how much time do you have? Because we've got quite a few questions.
I can give you probably another 15 minutes if that's okay.
That would be fantastic. Okay, so we have a question by also COBRA. Martin, do you believe that financial repression is a prerequisite for SA economic sustainability?
Okay, well, I'm not sure that I understand what the meaning of financial repression means, because it sounds pretty intimidating to me. Can we have a clarification of the question? Because I don't want to make up the answer.
Okay, we'll move on to the next one. Hopefully, if Borshoff can do that, that would be great. The different funding initiatives and worse at UIF seems to by and large fail or inadequate. What next?
Okay. So UIF, so it's a very complex and a correct question. We've been in negotiations for, I would say, 6 weeks now, pretty much daily, in the NEDLAC chamber, with the Department of Employment and Labour, with the board of the UIF, with the commissioner of the UIF. We're making progress. It's been painfully slow, but they have now, I think, distributed to something like 2 million beneficiaries, and we now have actuaries from all sides, from business, from labor, from government, from the UIF, comparing notes. That happened in the last sort of 72, 96 hours, to make sure that we have common cause as to the solvency of the UIF, as to what the actuarial liabilities are. And obviously, what was a 3-month process is not going to be long enough. We're going to have to extend that 3-month process for longer. The president has talked about 40 billion rand being available. If in fact that 40 billion rand is to be utilized, then we can certainly go not only beyond 3 months, but there are a number of people who are not beneficiaries of the UIF, who need the support that the UIF can actually provide. And we are investigating that. That obviously requires a change in legislation. So we're seeing, if it can't come from the UIF, what alternatives are available under the circumstances. But it's correct that it's another manifestation for me of the fact that many institutions of state were incapacitated or broken and need to be reinforced. And again, we offered pretty relentlessly for about 4 weeks. We had a breakthrough about 2 weeks ago. We offered to put private sector capability, all pro bono, by the way. Nobody was seeking a return. We just wanted to fix this with competent, capable interventions. And there was a reluctance to take us up on it. And eventually we had, as I said, a breakthrough. It's probably worthwhile saying, I don't know whether you have anybody from sort of the public sector on this call, but it's worthwhile saying that the trust deficit is as significant as it's ever been, maybe more so. And it's by the way, it's a two-way deficit or a three-way deficit. It's not just that government doesn't trust business, business doesn't trust government. You know, labor is mistrustful of business, and so on and so forth. Now, I think that that's, you know, actually the biggest single challenge that we face as a country, other than sort of COVID-19, is the trust deficit. Unless and until such time as we address that directly, we're going to waste time and resources that, frankly, we don't have to waste currently. My sense is that there is an opportunity which we're seizing. We've seen enormous progress in the past 8 weeks, or 10 weeks of the lockdown, 12 weeks, I suppose, since the beginning of March, which I wouldn't have anticipated if you'd have asked me this question 4 months ago. And I spend a lot of time in this, doing this stuff, a lot of my attention in NEDLAC and with government and with Labour. I would not have thought it was possible. So we've made progress. It's just painfully slow and inadequate. We need to ramp it up. And every single one of us can play a role in that respect, which is why I'm so pleased to be, you know, allowed to speak on this platform, because, you know, if you can mobilize that resource effectively, then it can make a very significant difference. There's no doubt about it.
We have a question by Ernest Matthewson. Martin, you make mention of dialogue with the government in relation to the various issues we are discussing. But in truth, does government really listen, given its continuous focus on populist socialist initiatives that will put the final nails in the economy's coffin? What we hear from government, from the president down, is extremely worrying.
Yeah. So I don't disagree with that. I know that's a double negative. It's deliberately a double negative, by the way. I don't disagree because for many people who are not familiar with the nuancing of what is being said, it's easy to interpret it in that way. The reality is that there are multiple constituencies that are being spoken to at any one moment in time. That's the problem. It would be so much easier if the president just said what I'm sure 90% of the people on this call feel, and I do likewise. The trouble is that we don't represent 100% of the country. We really don't. And we need to pull those people across the line in a persuasive manner. I mean, I'll give you an example. The biggest shock to my system probably came last week. This is not sharing a confidence, but I need to be careful how I express myself. when I'd had two meetings like this, not with as many people necessarily. One was with Professor Salim Karim. You've all, I'm sure, seen him on TV. I think he's superb, by the way. We had a meeting with him and some of his colleagues. We wanted to get under some of the issues in detail. We wanted to understand. Obviously, it was against the backdrop of some of the members of the MAC having spoken out in public, which had created its own dynamic. It was followed by a meeting that I had with church leaders, including the Catholic and the Anglican archbishops of Cape Town. Okay? That was in the afternoon, about how they could be advocates for behavior change. Because I am personally convinced that if we don't have behavior change, then we're going to see a massive acceleration. We're not going to be able to put a brake on the velocity of transmission. It's all about behavior change. And we can cast our minds back to the days of HIV and AIDS, when there was an advocacy program for behavior change in the ABCD, you'll all remember. And it seemed to us that speaking to faith-based leaders was key to that, because they have better reach and access to the community at large than, frankly, anybody else. So it was an avenue we wanted to explore. We had a very constructive conversation, and 2 hours later, the president appears on TV and announces that the places of worship are going to be open from the 1st of June. I thought I was going to have a seizure, because I'd been in 2 sets of conversations where Professor Karim volunteered that one of the worst places to open up were places of worship. They're just an incubation zone for the transmission of the virus. It's not that people shouldn't be able to go to their places of worship. It's that actually they're putting everybody else at risk. The entire congregation is put at risk. And you'll have heard about patient 31 in Korea and so on and so forth. And if you haven't, you should look it up, because it's a bad and good story. Now, that decision, I don't believe, was taken in a vacuum. I'd been in previous discussions with the president and members of his cabinet where the issue of places of worship had been discussed. I can only assume that it was necessary to convey that message to people that are not the people that I'm communicating with. Because I don't believe that the president, who I respect, if there's one job I wouldn't want to have in this country right now, is being the president, closely followed, by the way, by the Minister of Finance. I think he's got an equally appallingly difficult and challenging job right now. But I think that we do need to recognize that although it comes across as mixed messages, in a way it's mixed messages because there are different constituencies that are being spoken to. And it's very difficult to get everybody on the same page. It's not an excuse, it's an explanation of what I see happening. But, you know, I react the same way as the questioner does, which is, you know, it creates a headwind, you know, opening up the churches. By the way, none of the archbishops, and I spoke to them again on Saturday, none of the archbishops or the bishops or the president of the South African Council of Churches that I was speaking to are in a hurry to open their churches. It's not that they don't want to. They feel that, you know, if they have to do, you know, online, you know, services, they'll do online services, or they'll do free-to-air services on the TV and on the radio until they can be more comfortable that they're not putting people at risk.
An anonymous attendee has made a statement which I'll read out for our Facebook and YouTube audiences. More a statement than a question, but if we cannot rely on a competent state to bail us out, then perhaps it's in the ashes of the old way of doing things that fertilizes an incredible economy of new ideas and entrepreneurship. We'll need to look to ourselves to get out of this crisis. Yeah, I like the glass half full approach. So the question, also by an anonymous attendee, it's important for public and private healthcare sectors to collaborate and work closely. When the pandemic reaches astronomical proportions, there will be pressure on the public sector, hospitals and other facilities. The private sector may need to step in here. To what extent is dialogue happening in this regard? And I also want to add to that, and maybe you can add, what are your views in relation to the sudden shutdown of these private hospitals? when they detect an outbreak of COVID, as happened with Morningside Clinic. Are you on mute?
Right, I'm on mute. I was looking at the question. Okay, I apologize. So let me answer the last question first. And I speak as a sort of layman. I don't know any more than anybody else. Have you not noticed that there are now 7 billion instant experts on COVID-19 around the world? Everybody's an instant expert. And then you mentioned that to Professor Karim, and he says, well, if anybody, including me, tells you that they're an expert on COVID-19, take it with a pinch of salt. I've been a virologist, he says, for the last 40 years or whatever it is of my life. And I learn more every day than I thought I knew the day before. So one of the things that he told us was, because I'd asked him this question, I said to him, you know, to what extent is it true that if that the virus sticks to clothing? Because there was at one stage, there was a talk about the virus sticking to clothing, or to paper, or to cardboard. So he said, well, the tests that have been done, and he referred me to the tests and the research that had been done, suggests that on surfaces like clothing or cloth or paper or cardboard, it sort of lasts for a few hours, 2, 3, 4 hours. So in fact, if you were to have a hymn book and you were to hold it and you were to pass it to your neighbor, then it's quite possible that the virus would be transmitted. In the case of wood, and more specifically metal, it can last for up to 4 days, 4 days or thereabouts. He says when he went to St. Augustine's, you'll all remember the outbreak in St. Augustine's, which was more extensive than Morningside. He walked around and he realized the entirety of the hospital is stainless steel. Everywhere you look is metal. Now, actually, he says, coughing and sneezing are not the most effective way of communicating the virus. Breathing and speaking is. And then he talks about how different people have different levels of emission of droplets. Hopefully we don't all spray when we speak, okay? But, you know, Professor Karim says he emits a lot of droplets. So when you've got people walking around a hospital and they're speaking and actually they haven't got a clue that they are putting people at risk just by breathing or talking or shouting or laughing, and all of the surfaces are metal, that is exactly how the virus can get transmitted at pace and stay there unless it's regularly cleaned. So that's the answer on I think on Morningside. On the previous question, which is a very good question about innovation, I mean, that's exactly correct. We've got a group of people who are working now on 4IR and how we can accelerate a 4IR program. And there's no doubt that, as I said, we're going to leapfrog in the education space. What we've got to do is work out how we do that. I also believe that the business community, and it's not large business, it's actually much more small businesses and entrepreneurs, are much more creative than most other sectors of the economy. And we find nooks and crannies to exploit and explore, and that's exactly what we must do here. At all times, hopefully, ensuring that there's integrity and sort of an ethical bias to the work that we're doing. Because, by the way, any conversation would not be complete without reinforcing the fact that even in COVID-19, corruption and maladministration is coming to the fore. We're seeing it in the context of the procurement of PPE, by the way. It's a big concern. It hasn't disappeared. In fact, what has happened, unfortunately, is that the prosecution authorities are so tied up and are so constrained and hamstrung by what they are having to deal with in the moment and by the circumstances within which they find themselves, that they can't prosecute as they would ordinarily have done. It's a big issue. I think it increases the responsibility on each and every one of us, by the way, to be more observant about what is happening around us. I think that we need to call it out. We recognize as Business for South Africa that we were so focused on issues relating to the healthcare system and the economy that we didn't actually consider issues like crime and corruption. We didn't consider issues such as education, which we've now brought back into areas of particular particular focus. There was a question that I noticed, by the way, I just might pick it up if that's okay, on private and public facilities. There is extensive discussion between the private healthcare sector and the public healthcare sector. And we know that, for example, the Western Cape's a good example. The public hospitals are, the ICU facilities are almost at saturation, and they're going to have to move into the private healthcare facilities as a matter of urgency. There are discussions, perhaps I should call them negotiations, that are still going on as to the rates that will apply. But we all know that there's no hospital that's going to be able to close its door. It can't from an ethical point of view, but nor should it, to somebody who needs treatment. And we're going to have to ensure that we can maximize levels of cooperation and collaboration in the medical sphere between the public and the private sector to achieve that.
I have two final questions that we'll deal with. The one question relates to the property sector, residential property sector. What is your outlook considering that we have a low interest rate environment?
Okay. So we've seen, and I'm sure many of your members will know about this, and we've been engaging extensively with SAPER, which is the Property Owners Association, but also for residential as well as for commercial and industrial, that there's been a massive drop-off in both demand and in price. Rule of thumb is between 30 and 40% price reduction. That'll come back over time, I presume, but a low interest rate environment unfortunately doesn't resolve the issue, particularly when we've got the level of increasing unemployment and people curtailing expenditure. We're going to see a natural curtailing of expenditure. Luxury goods are not going to be, the order of the day, I fear, anytime soon. Staples, of course, will. And therefore, again, we're having to look at ways in which the property sector can be supported, including and in particular the financial sector demonstrating forbearance for the property sector, and the property sector similarly doing so in particular for its tenants.
Final question by anonymous attendee. You mentioned that COVID-19 should not be used to institute policy changes. This is not the time to do it. Is there a possibility that the Department of Health may want to do this with regards to NHI? Would this be an opportunity for government to push NHI policies?
So it's come up already is the answer, or rather the suggestion has come up already. Personally, I don't think there's a realistic prospect of that being the case. We are a long way away from the practical implementation of NHI. Business Unity South Africa has a work stream almost entirely devoted to it. We've done so for many, many months, more than months, a year, I would say. For me, the biggest single issue with respect to NHI is not whether ideologically it's the right thing or not. It's the financeability and the implementability of NHI. And we don't have the fiscal headroom at the moment. So when we do, we can have that conversation. At the moment, I think it's a sort of distraction. We're going to have to spend a long time repairing our healthcare system in the light of COVID-19. What has become apparent is, again, how deficient it is. For those of you who don't know, because it doesn't appear on my CV, I spent 6 months on the board of Chris Hani Baragwana. Now, that's an interesting and an intimidating experience, I have to say. And it was very clear that the structures, the governance, the systems were in total disarray. I'm not telling you anything that you don't know, but it was a first-hand experience. I was taken off the board so I could be on the board of SAA, so I don't know whether I went from the fire into the frying pan or the other way around, clearly both. So I do think that we will, as a society, have to focus a lot of resource on repairing the public healthcare system once we've got through COVID-19. And again, it's an area where I'm sure there are many people who are on this call who can play a critical and an important role. But no, I'm not concerned that NHI is going to be implemented in the next 6 to 9 months. I don't think that's a realistic prospect.
Martin Kingston, thanks so much. I'm not sure if the panelists have anything to add, but before we go, please visit the COBRA website, www.cobra.org.za. You'll find this webinar on the site, or you can visit the Facebook page, YouTube pages, also the partner companies. So you'll find the resources in multiple places, so please tap in. I'd like to thank the Facebook audience and the YouTube audience for joining today, and of course, the attendees. Thanks so much, Martin Kingston. We are going to have you back. This is a moving target. Things do change overnight, so we hopefully will get you back sooner rather than later. Thanks so much. Thank you all.